This morning, a medical focus. Cancer deaths are on the decline, but are we any closer to a cure? We'll get an update from a top cancer specialist. Plus, Alzheimer's, the disease that robs us of our memory. Two top Alzheimer's researchers will fill us in on the latest efforts to eradicate it.
Now from 42nd and 2nd, this is New York's very own Pix 11 News Closeup with Marvin Scott.
Good morning. Medically, there's a good news, bad news scenario when it comes to cancer. The positive side shows that the number of cancer deaths have taken the sharpest decline in recent years. On the negative side, there are still rising numbers in certain forms of cancer, like pancreatic and liver. And the medical detectives, they continue their never-ending research for that elusive cure. Where do we stand with all that research, and are we any closer to eradicating this dreaded disease? This morning's distinguished guest certainly is in a position to fill in the answers. Dr. Samuel Waxman is founder and CEO of the Samuel Waxman Cancer Research Foundation, which has raised over $100 million in research funding since its inception and funds grants to more than 200 medical researchers from all over the world. Dr. Waxman is also the Distinguished Service Professor at the Icahn School of Medicine at the Mount Sinai Medical Center. So good to have you with us. The latest data shows that there's been a decrease. The American says the largest drop, at least in the last 6 years. To what will you attribute that?
Well, of course, it's due to a lot of hard work, research, and the delivery of research to the patient. We can look back even further and say that the mortality rate of cancer has dropped about 20% in most forms of cancer. And a lot of it has to do with early diagnosis and prevention. The prevention, mainly educating on cigarette smoking, has made a huge difference in lung cancer incidence. And early diagnosis with mammography and colonoscopy really contribute to most of this.
So new therapies, new diagnostic procedures, and the fact that 90% of lung cancers were attributed to smoking.
That's correct.
So many people have stopped.
Right. Many people have stopped, and so the numbers of getting cancer, lung cancer, has gone down.
So what can you tell us about the advancement in treatment as looking towards that elusive cure? I know some forms of cancer have reached a cure rate.
Right. So science is giving us a new way of identifying individual cancer types. It's much more sophisticated than it was even 10 years ago, so that a form of cancer is defined by what causes it, mainly at the gene level. So one can deliver treatments that are targeted to hit the cancer cells more selectively. And that's very exciting. And the goal here, and is happening, is go from non-specific treatments like chemotherapy, which hits all cells, including normal cells, to a more targeted treatment that's selective against cancer cells. And there are some incredible examples of that that are already happening to patients in a positive way.
Now, one of the primary treatments for cancer has been chemotherapy, but I know in your research you've been working with a combination of chemotherapy and with drugs, and how is that working?
So chemotherapy surely has a role to play in cancer treatment, and in some forms of cancer it has been dramatically successful. It also the problem is that cancer cells rapidly get used to having that chemotherapy and become resistant. So we combine it with other kinds of treatments. So chemotherapy will stay, but maybe not as heavy amounts, and will be partnered with more specific drugs to attack the cancer cells specifically, which is the kind of treatment that I'm interested in.
A lot of it is immunotherapy.
Certainly immune therapy has come along very rapidly in the last 5 years. It's a very exciting new partner in the management of cancer, and it will only get better as we learn how to use it. It took 30 years or 40 years of trying to understand how to use chemotherapy, with many, many types of chemotherapy drugs. There are many, many types of immune therapies now, and we have to learn when to use it, how to use it, who should get it, and how to use it with other treatments.
And it's showing promise?
It's showing amazing promise in a certain number of people, moderate effects in others, and unfortunately a large number of cancers are just not responsive to it, and we have to learn why and make them sensitive.
Now the question is, I know you have in some forms of cancer, have you been able to determine the cause of these cancers? I know some have been, but others are elusive, like pancreatic cancer.
Right. So Marvin, that is what science is all about. the more we look into cancer, the more we have an overall theme, at least in my mind, and that is that cancer is due to abnormal gene function. And
I want to mention, we have on the screen there, Lynparza. I mentioned pancreatic. This is a new drug that's being used for the treatment of pancreatic cancer, and it's been showing some promise. Is that correct?
It is. It's showing some progress. I do believe it's still too early to make it a game changer. I don't believe it's going to be a transformative treatment, but anything that contributes to making pancreatic cancer more treatable is important. And this has the possibility of making pancreatic cancer more treatable than before.
Would you say that this is a major breakthrough? I know they want the FDA approval for this right now. Right?
I think it's too early for me to say that. I sound very political, and I'm not, but I'm very strict on, we can define what a breakthrough is. Just as an aside, the FDA has been more than delighted to approve a drug in cancer. Many drugs get approved with some success in the patient situation, so it depends on how you measure success. Is it months? Is it years, or is it longer? Mm-hmm. So I don't know where this drug is. Will it take, if let's say it doubled the average survival of pancreatic cancer, so you may be going from a year to 2 years. Do you consider that important? That's a dilemma in understanding cancer management today. It's incremental, getting where. So you don't expect it suddenly we're going to cure it. We want to know how to treat it. This drug may be part of treating pancreatic cancer and extending life and quality of life. Too soon to call.
But it's shown some success in clinical trials, and it's still in clinical trials.
Yes.
So it's not available to the public yet.
I'm not sure. I haven't been following it that
Unless
closely.
you're in the clinical studies, from what I read.
Yeah.
So let me ask, we're on the subject of pancreatic cancer. It's one of those cancers that still, the elusive cure is not there. But it's the third largest cause of death of cancers. Alex Trebek. We've heard so much, there's been an awareness as a result of Alex Trebek's situation with pancreatic cancer. Why is it so difficult to detect?
Well, there's no early marker for pancreatic cancer. It's located in a place where the symptoms are vague, and by the time you have clear symptoms, it's often locally advanced. So the problem is early diagnosis and the gene makeup that causes this cancer makes the cells quite resistant to all treatments. So we got to hit it hard early, and sometimes when you hit it hard early, you can take a situation and really have impact on the patient.
Now, you face so many challenges in the research lab, and you have 200 researchers working in your foundation. What's the greatest challenge that you're facing in this research?
Well, I think there are two things that the foundation focuses on. One is to understand why and how to get the last cancer cell eradicated. So there are these cancer stem cells, so to speak, that are generally in a state that are resistant to almost all our treatments. It's due to new gene information that helps them survive. We have to understand that, attack those cells, and eradicate it. And I think we're on the way to do that.
Now, is cancer, I read somewhere, cancer just part of the stage of aging? I know you have found a linkage between age and cancer.
Right. So clearly, the longer one lives, the better chance you have of getting cancer. And I think it's hogwash to think, oh, you get old, you get cancer. That's not the way we should be thinking. The world is in an aging situation worldwide. Therefore, we expect the incidence of cancer, and it is, rising as we age. It's going to be an amazing problem to overcome. But there is a clear link that aging is the major driver of cancer. So the science is building to connect the two. What is it about aging that makes cancer go up? And I think we can find that answer and come up with some kind of a predictive treatment to perhaps prevent that rise as we age. And I think that's a huge challenge.
We talked about pancreatic cancer, one of those which you're still looking for that elusive cure. Another one is cervical cancer. Now, the Journal of Lancet Public Health Journal said that in the next 2 decades, there's going to be a dramatic rise in cervical cancer. Now, you talk about drops in so many other forms. Why is there an expectation of, oh no, I'm corrected. They say within, let's reverse it. There will be an elimination.
Correct.
An elimination. Let me repeat that.
Right.
Elimination of cervical cancer.
Exactly
The research
right.
is so progressive.
No, I think that's the good news. Cervical cancer, in almost every situation, is a viral causative disease, HPV. And there's been a vaccine against HPV that is remarkably successful to preventing cervical cancer. I just wish every young person, male and female, take this vaccine. It's not being taken seriously enough. But if we do that, we can eradicate cervical cancer and also markedly decrease anal cancer as well.
But there is this progress. There is hope there.
Amazing. In
cervical cancer.
Yes, and they're like, if we can get it, particularly say to Africa, where cervical cancer is so much more common, we could eradicate it there. It's a terrible disease, and it can be beaten.
I know where I was getting confused because the American Cancer Society estimated a large number of cervical cancer
That's
deaths
correct.
this year, but the journal says in the next 2 decades they hope it'll be
We
eliminated.
can stop that rise because it's an infectious disease, like we did so successfully in other viral-mediated disease.
There's so many things to talk. Is there, down the road, you're talking about some vaccines. Do you think there could be an effective vaccine to tackle all the other cancers out there that are not cured yet?
I doubt it. I doubt there's going to be one situation unless we can find there's going to be a gene pattern that's going to predict cancer. We can find it early. We can start seeing it probably at age 40 or earlier. If you find that pattern, you could get on top of it more rapidly and start to do real prevention. And that's a dream I have, actually.
So the final question, and our viewers want to know, can we beat cancer? Is there a cure down the road there?
Right. There's what we hope is, number one, we can decrease the incidence. Number two, can we prevent it? Number three, can we make all forms of cancer treatable? We can accept living with diabetes with insulin. We can accept living with heart disease with medication. We want that for cancer patients. We want a person who has cancer to say, I have cancer, but I'm being treated successfully. That is what we should hope for.
That is your challenge?
That is the challenge.
That is our wish for you and your foundation.
Absolutely.
Dr. Samuel Waxman.
Always a pleasure, Marvin.
Thank you so much for your insight.
All right.
We're going to take a break. When we come back, we'll talk about another dreaded disease, Alzheimer's. Stay with us.
You're watching New York's very own Pix 11 News Closeup with Marvin Scott.
More than 5 million people in the United States and millions more worldwide have Alzheimer's, a disease that drains us of our memory and places untold burdens on caregivers. Currently, drugs only temporarily ease symptoms, but they don't alter the course of the disease. Now, there have been hundreds of failed trials in search of that elusive cure. Another disappointment just this past week. And to find out just where we stand with Alzheimer's research, I'm pleased to be joined now by Charles Fuschillo, Jr. He's president and CEO of the Alzheimer's Foundation of America, and Dr. Jermaine Ross, Director of Translational Medicine and Immuneering at the Alzheimer's Association of New York. Thanks so much for coming in. I was hoping we could start on a positive note, but you just had a failure of a test that has been clinical trials that have been going on for 5 years. Would you tell us about that?
Yeah, so with the Diane study, which we recently just got news about last week, that initiative was started about 12 years ago to recruit essentially patients who developed the disease quite early, so early onset of Alzheimer's. And so the goal there was to track those patients over time and then enroll those patients into a clinical trial for therapy. And so a couple of partners were part of that, including Lilly as well as Roche and Genentech. But unfortunately, the two drugs that they tested on those patients didn't work out. And usually the measure for success for that is to try to recover some kind of memory deficit and decision-making deficits.
This has been a clinical trial going over 5 years, so this is a big setback.
It's a tremendous setback, but there have been so many failures over the last decade or two, but we never give up hope, and that's why we have these trials. And the main thing, Marvin, is the federal government really needs to step up and put more money towards research. This is a national epidemic that they don't recognize. When you look at the cost of caring, in this nation, more than $250 billion, and they only appropriate $2.8 billion this year, which is an historic amount for Washington. Still not enough when these trials cost billions and billions of dollars, and we've had too many failures. It's about the research, and you need the money for it.
Didn't Congress just approve another $350 million on top of that?
Which got it to $2.8 billion. You know, we're applauding that, but it's not enough. When you look at some of these trials that have failed $800 million, $1 billion, it's all about the dollars that are necessary for the research. If we're going to get hope to the millions of people suffering with this disease, and we know what's going to happen if there's not a cure by 2050 or 2060, it's going to triple in numbers in this country. We need more research dollars.
All right, we talked about one failure, but there's also something on the positive side, another drug called aducanumab, that it's found that it's some reduction in cognitive and functional decline. Is this a positive drug? Does this bring hope for you?
So it's a little bit too early to judge that. So Biogen is the company that's developing out this drug. Early last year, they actually determined within two clinical trials that the drug wasn't actually working. So they actually stopped those trials because there didn't seem to be any efficacy or effect on the patients. But what they did notice is that they were still getting data in, and so they wanted to essentially look at that data and see whether or not there was any effect. And so they were actually able to identify some effect with aducanumab in their patients.
You both are involved with the research of those medical detectives out there looking for a cure. Right. And that's what we all want to know. Are you any closer to eradicating this disease?
I'd like to say yes and give us some positive news, but every day we move a step closer and we never give up hope. And that's why it's so critically important to have the necessary dollars to continue this research, to expand it, to make sure that the targeted population is larger than some of the samples that are out there as well.
We know the causes of it. Are there symptoms? There are so many myths out there. We forget our car keys or something else. We can't find our wallet or whatever it is, and we think, oh, it's the onset. That's not true. What are some of the symptoms that people should honestly look for?
Well, we always like to say that if you find your keys and you don't know what they're for, then there's an issue of concern out there. But you know, when you see somebody forgetting current events, having memory losses, changes in moods and behaviors, it's something that needs to be addressed. And all too often, Marvin, people are in denial, and they'll make an excuse for a loved one and say, oh, he or she is just getting older. Right. Well, that's not the case anymore. You need to address it right away. Early intervention, trying to change your lifestyle, creating a healthier lifestyle is so critically important. Look, we preach this all our lives. Exercise, eat right, don't smoke,
Every doctor tells us
don't drink. It's everything. But are people listening to that? Yeah. And you know, we encourage individuals, I know the doctor does as well, choose a healthy lifestyle. Be careful of the environmental factors that you live in.
And I think on so that's on the patient side and the family side, but on the research side, we need to put more investment, as Charles was saying, more investment in identifying biomarkers to identify these patients before they become symptomatic, because it's definitely becoming the consensus that if we can treat this disease before it gets too late, we will have a better success.
Would you explain, because I don't think everyone understands the difference between Alzheimer's and dementia?
Sure. So with dementia, that's essentially a collection of memory diseases, including Alzheimer's, which is the most prominent of all the dementias. But you have other dementias such as Lewy body dementia, which Robin Williams had. You also have frontotemporal dementia and so on, and vascular dementia as well. So you have other diseases within that.
Is it true that there's a link between lack of sleep and Alzheimer's, particularly in men?
There's growing evidence to support that. So to explain a little bit of the biology behind Alzheimer's, essentially there's a protein in your brain called amyloid beta, which accumulates over time and causes a lot of the destruction in your brain. And so there's a mechanism by which that protein is not being cleared out of your brain. And when you sleep, there's a process that clears a lot of the garbage, if you will, out of the brain, and that could be part of the.
Now you talk about lifestyle, being active. Someone even said to me, "Get out there, play golf. It's social. It's an activity. You're doing something every day, regardless of what your age. Particularly when you're aging, just the importance of being active day in and day out. Is this something that can prevent the onset of Alzheimer's?
Look, we don't know what's really going to prevent it, but we say choose a healthy lifestyle. Socialization. Marvin, I want to encourage you to go to ballroom dancing, because from head to toe,
I can notice what we're doing tomorrow night.
There you go. Because from head to toe, you have to know every step. Yeah. And what you're doing without even knowing it is exercising your brain. So socialization is so critically important. Anything you do, like golf or take up a new hobby, a language, a sport, exercises your brain without even knowing it, and that's critically important. Whether we're young, middle-aged, or aging, it's all critically important for all of us to continue to exercise our brain. We take care of our bodies. We try to lose weight. We try to exercise all too often. But all too often people forget what you put in your body affects your brain. Mm-hmm. What you do to your body affects your brain as well. Talked about the lack of sleep, smoking, excessive drinking. All this has a negative effect on the brain.
And it's also good to play the crossword puzzles.
That's right.
It's very good.
It makes you think about it. And that's right. In other words, it's what you say, don't let the brain get dormant.
Right.
Keep it going.
But it's actually what you said. It makes you think about it. So at that time, you're exercising your brain.
Mm-hmm. So also, let me ask you this, because I read this in preparing for the questions for you guys,
Sure.
that certain foods are negative. It contributes to the problems in your brain, and other foods are very good to help prevent perhaps any incidence of Alzheimer's. Would you talk about that?
So there are some studies right now that are trying to identify what those particular foods are. So recruiting a very large cohort of subjects to identify which would be most beneficial to decreasing the risk for Alzheimer's disease. So
antioxidants.
Antioxidants is really at the top of that list. Yeah, absolutely.
Well, we always like to say, people forget what you put in your mouth, if we know affects your body, but it also affects your brain as well.
That's it.
Now, I saw some of the good ones are what? Tomatoes, kale, spinach, broccoli, olive oil, pears, beans, apples, tea, and wine, red or white.
Not in excessive use. You'll enjoy it, but not in excessive use.
But those are good for you.
Yes.
And the ones that are bad for you?
Hamburgers, fries, things like that. Like anything, the usual suspects.
I better change my diet. Okay. So where do we stand? That's the question. You work with this day in and day out. You're medical detectives. Is there any hope out there on the horizon?
100%, absolutely. And we encourage the factors of that. There are trials going on. There are trials that are in different stages that have successes. We always have hope that there will be one day a cure, there will be better treatment. So just like the previous doctor talked about, we want to ensure that people have a quality of life while living with this disease, and that's where the better treatments will come in.
Last question I have to ask you, because you also are concerned about the caregivers.
Yeah.
This is as much of a burden on them as the one who has the actual Alzheimer's.
Absolutely.
And you both have programs for
We
them.
both have programs, and it's overwhelming. The emotional, the physical, and financial stress that's placed on individuals. You know, when you look at the more than 5.8 million people, Marvin, that are living with this disease, use a multiplier of 3 or 4 for a caregiving team. You see how prevalent this is. So support groups are so critically important. We have a national toll-free helpline of licensed social workers 7 days a week. We always encourage individuals to call, seek help. You can't go on this journey alone.
And same with the Alzheimer's Association. We have a 24/7 helpline. The number is 1-800-272-3900. And so that gives a tremendous amount of resources to the patients and their families who want.
All right, Charles Fusillo, President and CEO of the Alzheimer's Foundation of America, and Dr. Jermaine Ross of the Alzheimer's Association right here in New York. And you can reach out to either of you and your associations, your organizations for more questions or any help. Thank you so much for joining us.
Thank you.
And for your insight, and good luck in your continuing research.
Thank you.
Thank you, Marvin.
We'll take a break. We'll be right back. For more information, I want to give you those phone numbers again for the Alzheimer's Foundation of America. The phone number is?
It's 866-232-8484.
And the Alzheimer's Association?
1-800-272-3900.
Okay, thank you so much. And, you know, the medical researchers, they continue to work with hope that their research and new technologies will enable new breakthroughs, and that the day will come when most deadly diseases are finally eradicated. That's our broadcast for this week. I'm Marvin Scott. Thanks so much for joining us. Enjoy the rest of your Sunday, everyone.